Hello everyone. Good day, ma'am, and good day to you classmates. So, my report is a continuation with Miss Dichin Rose Malaras, which is I start here in East Coast fever, which is a disease of our animals. So, let's start. East Coast fever is an acute disease of cattle. It's usually characterized by high fever, swelling of the lymph nodes, dyspnea, and high mortality. So, East Coast fever kuno is one of the serious disease of the cattle. So, mauna ang bation nila is taas kaayo ang ilang hilanat, swelling or mo enlarge ang ilang lymph nodes or some parts of the body, dyspnea or shortness of breathing, or ang worst is they can subject into death. So, caused by Theileria parva and transmitted by the tick vector, Rhipacephalus appendiculatus is a serious problem in East and Southern Africa. So, mauto ang Theileria parva kuno ang cause ani nga sakit, which they can transmit to the ticks, especially if kanang na certain situation nga if ang ticks mo mo pikit sa atong animals or which is the cattle, so maunang maapektuhan gajud. So mao kuno ni ang serious problem sa East and Southern Africa. Then etiology and transmission. The African buffalo or Cincerus scapher is an important wildlife reservoir of T. farba, but infections is asymptomatic in the buffalo. So as we notice, no, ang mga buffalo is mao gajoy reservoir aning T. farba, which is kanang even kanang they are kanang infect with this T. farba, asymptomatic gihapon sila. So T. farba transmitted by ticks from idle cattle or buffalo cause severe disease in the cattle. So kung mo transmit ang T. farba sa cattle or buffalo, so ang mas maapektuhan sa disease is ang cattle gajud. But buffalo derives parasite differentiate poorly to merocytes in cattle and generally are not transmitted by ticks. Hence, buffalo T. farva are maintained as a separate population. Buffalo T. farva were previously considered as separate subspecies, T. farva lawrenci, but DNA typing indicate that the cattle and buffalo parasites are a single species. T. farva is usually high pathogenic, causing high levels of mortality, although some less pathogenic isolates have been identified. So, mao ay na makakos jud og mortality ang kining T. farva since ara kataas ay ang iyang pathogenic ani. So, pathogenesis, clinical findings and diagnosis. T. farva are sporozoites are injected into cattle by infected vectors or ticks. So, ang ticks jud ay ang kanang maka-inject ani sa atong mga cattle, no, and occult phase of 5 to 10 days follow before infected lymphocytes can be detected in GEMSA stained smear of cell aspirated from the local draining lymph nodes. Subsequently, the number of parasite cells increased rapidly throughout the lymphoid system, and from about 14 onward, cells undergoing merogony are observed. This is associated with widespread of lymphotolysis marked lymphoid depletions and leukopenia. Periplasmas is RBCs infected by the resultant merocytes assume virus form, but typically they are small and rod-shaped or oval. So, clinical signs vary according to the level of challenge, and they are ranged from inapparent or mild to severe fatal. Typically, fever occurs 7 to 10 days after parasites are introduced by feeding ticks. continuous throughout the course of infections and may be 106 Fahrenheit or 41 degrees Celsius. Lymph nodes are lymph node swelling becomes pronounced and generalized. Lymphoblast in gem-sustained smear of needle aspirates from lymph nodes contains multinuclear schisms. So aronosia develops and the animals rapidly loses condition. So lacrimations and natal discharge may occur. Terminally, dyspnea is common. So just what I say earlier, just before death, a sharp decrease in a body temperature is usual and pulmonary exudate pours from the nostril. Death usually occurs 18 to 24 days after the infections. The most striking post-mortem lesions are lymph nodes enlargements and massive pulmonary edema and hyperemia. Hemorrhages are common on the serosal and mucosal surface of many organs, sometimes together with the obvious area of necrosis in the lymph nodes and thymus. Anemia is not a major diagnostic sign as it is in baby shoes because there is minimal division of the parasites in RBCS and thus no massive destruction infection. Animals that recover are immune to subsequent challenge with the same strains but may be susceptible to some heterologous strain. So, most recover or immunized animals are remain carrier for the infection. So, treatment and control. Treatment with 1-Farbacuan and its derivative bufarbacuan is highly effective when administered in early stages of clinical disease but is less effective in advanced stages in which there is extensive destruction of lymphoid and hematopoietic tissue. So immunization of cattle against farva using an infection and treatment procedure is practical and continues to gain acceptance in some regions. The components for this procedure are crew-reserved opozoites, tabulate of the appropriate strains of Stellaria derived from the infected ticks, and the single dose of long-acting oxytetracycline given simultaneously, although oxytetracycline has a little therapeutic effect when administered after development of disease. It inhibits development of the parasite when given at the outset of infection. So, cattle should be immunized 3 to 4 weeks before being allowed on infected pasture. So, it needs 3 to 4 weeks before i-allowed siya sa kanang open pasture ang ato dangkitan. Parasitized von Fide cell containing the iscosome stage of the larva and the annulata can be cultivated in vitro as continuously growing cell lines. In the case of the annulata, cattle can be infected with a few thousand cultured cells. Attenuated strains produced by serial passage of such culture form the basis to live vaccines used in several countries, including Israel, Iran, India, and the former USSR. Incidence of East Coast fever can be reduced by rigid tick control, but this is not feasible in many areas because the cost and the high frequency of acariciidal treatment is kanang required. So, another disease of animals is a ringworm. This is the most common infectious skin disease affecting beef cattle. So, we are kanang familiar with this kanang disease since it is common. So, it is a disease to the skin of our animals. It is caused by fungus and is transmissible to man. Yes, as we notice to our kanang some of humans. So naapod ni siya nga sakit. Typically, the disease appears as crusty gray patches, usually in region of the head and neck and particular around the eyes. As a first steps in controlling the disease, it is recommended that whenever possible affected animals should be segregated and their fence or stall cleaned and disinfect. So, ang first steps ko no para ma-controlling a disease is you have to segregate your animals. So, ang pen food ko no or ang area disinfect. So, clean the cattle which have been in contact with the disease should be watched closely for the appearance of lesion and treated promptly. Proper nutrition, so it needs proper nutrition para ma-control ng disease, particularly high levels of vitamins A, copper, and zinc while not a cure. So, kay wala may certain kuno nga tambal para ingani, so you have to kanang maintain rakan sa imong animals into proper nutrition. Labi na kuno dapat kini nga mga vitamins is kanang surely nga na take nila. So, sure pud nga naa sila ani og kuan. So, kay kini kuno will help to rise the resistance of the animals and in so doing after some measure of control. Contact your vet or the fed store for the products to treat this disease. So, kanang if naana ni certain nga disease ni grabe na, so you have to contact the veterinarian or mangutana ka dito sa store which is katong store nga nagproduce og food. So for sure they are kanang familiar with this kanang disease. So maybe they have advices or kanang mahatag sa imo nga treatment para ma prevent or ma-control ni nga sakit. So using a wormer like AFA-9 will kill lice and help prevent cattle from scratching, causing skin damage and a place for the fungus to enter. So next is the milk fever or also known as parturient hypocalcemia and parturient paresis. So, it's a disease which has assumed considerable importance with the development of heavy milking cows. So, this kanang disease is maoni ang sakit kasagaran sa kanang naggatas na mga cow. So, tungod na sa kadaghan kaayo siguro sa ilang milk, so mo-enter dayon nga disease. So, decrease in the level of ionized calcium in tissue fluid is basically the cause of the disease. So, ang cause ay kuno ani nga disease is pag mo decrease or mo lower ang ilang ionized calcium. So, in all adult cows, there is a fall in serum calcium level with the onset of lactations of calving. The disease usually occur in 5 to 10 years old cows. So, this disease ay mo mas kanang mo infect siya those cow nga mag-old na og 5 to 10 years. So, and is chiefly caused by sudden decrease in blood calcium level, generally within 48 hours after calving. So, symptoms. In classical cases, hypocalcemia is the cause of clinical symptoms. When we say hypocalcemia, it is a low level of calcium in the blood. So, hypophosphatemia and variation in the concentration of serum magnesium may play some subsidiary role. The clinical symptoms develop usually in 1 to 3 days after calving. So, they are characterized by loss of appetite, constipation, and restlessness, but there is no rise in temperature. So, dili ra sila ganado mukaon and then mag-constipate and dili sila
maka kanang makapahuway pag-ayo or di mapakali. So pero dili kuno taas ang ilang body temperature. So another disease is a calf score. So calves may develop score due to bacterial or virus infection. So scores is known as calf score or neonatal calf diarrhea. So the primary causes of score includes rotavirus, coronavirus, Cryptosporidium parvum, Salmonella, and Escherichia coli. So determine if the treatment is required. Calves are not moving around in the pasture. So mao ni ang bation sa calves kung they have this certain disease. So they are moving in the pasture with their tails up. So kanang magtaas-taas kuno ang ilang ikog. So probably in that case, do not treatment. So check to see if the diarrhea is yellow or white. If this is the case, treatment is probably not needed. So kung maura na ang cases, so dili pa siya kaadyo ka ng worst. So next, determine if the calf is looking listless. So calves that are lethargic or not participating much in playful activities with other calves are a red flag to pay attention. Calves that are also losing condition are also cause for alarm. So if ang calves kuno is kanang they are not kanang active in playing activities, so magludya na kibali si Josh, so kana nagneed na jud siya og attention para kanang i-check na nato. So check to see if the calf is dehydrated. So you can check for dehydration by pulling on the calf's neck skin. If the skin tense, this is a sign of dehydration. So pag pag mag-check ko no ta sa cow if they are dehydrated, so kuan ko na nato i-tent ko na nato ilang skin, which is kanang i-pinch bitaw nato ang ilang skin. Kung dugay gani kuno na siya mo balik into flat or kanang ang imong certain area nga gi-pinch dugay mo balik sa iyang original, kung dili na i-pinch, so maudod na sign nga dehydrated ang atong calf. So determine the calf body temperature. A normal body temperature range from 100.5 Fahrenheit o 38.1 degrees Celsius to 102.5 Fahrenheit or 39.2 degrees Celsius. So mao na ang normal body temperature sa atong cow. So anything outside of the range is a sign for treatment. So kung labas na ana or kanang lapas na ana nga range, so need na nato i-check ang atong calves para mahatagan siya og treatment, kay usually mao daw na ang sign kung waya na ana na range. So separate the sick calf or calves from the healthy herd. You'll want to do this to avoid the spreading the disease further. So this is what usually done if your animals have infected the disease, not just in this case. So di ba, kung masakit ang atong animal, so kuan nato siya i-separate from waya na infect. So para pod ma-avoid nato nga mukanat pa pag lala ang disease. So administer fluids using your veterinarian approved electrolyte solution. You may need to inject the fluid via IV or orally. So you have to ask your veterinarian kung kadto ba nga electrolyte solution is compatible ba ato nga sakit. So of course, sa pag treat nimo ato sa sick animals. So naay two ways. So via injection or kanang ipatingal ra siya largo sa atong animal. So follow appropriate nursing care protocol using your vet's guideline. In this may include providing shelter, feed, and warm place to sleep. So of course, you need to kanang follow the guidelines of vet. So unsay appropriate nga pag-care sa atong mga animals, labi na sa pag-provide nato sa ilang mga shelter sa pagkaon, and then dapat pud ang ilang place where they kanang asa sila mag stay is kanang dili pud comfortable pud sila, and then kanang dili kaayo bugnaw dito nga area. So warm ra ang iyang temperature. A drawback from providing shelter is maintaining infectious control. You will have to work extra to get rid of soiled bedding and disinfect everything that a calf will touch, from the floor to the fence panel and even the fed bucket. So, para makontrol nato ang sakit, so mao nang mag-desinfecta sa tanan nga na, na kibali na touch sa atong calf. So labi na gajud ang kanang fences or kanang mga bahugana niya, and then the floor of course kung asa siya nagstay. So we have to disinfect it. Ethnovet practice. Ingredients needed: Vasambo or Ocoros calamus leaves, 2 numbers. Dried ginger or Gingiber officinale, 50 grams. Guava or Phaegium guajava, tender leaves, 200 gm. The above materials are ground and made into a bolus and administered orally 1 or 2 times. So I think that would be all with regards to my report. So thank you everyone for listening. I hope you have learned something. So God bless.